welcome back to Real Talk with Cece. Here I am at home. We're doing a special today. Usually I typically do these videos in nature, but since I've been in and out of the doctor's office a little under the weather, we're going to do this one at home today. But mind you, behind me I am going to have a vision board. This is something that I will be covering later in my videos. It's about the power of manifesting your ideas into reality. And so, but enough of that. For now, we're going to be covering over panic disorder. This is part 3 of our anxiety series, which I will be covering for you today. Now, according to the research that I've done, it is said that panic disorder is actually a type of anxiety disorder that can cause panic attacks in which doesn't have a foreseeable trigger, and it just causes sudden feelings of terror and such as the following symptoms here that I have written down, along with rapid heart rate, chest or stomach pain. There will be difficulty breathing, there will be a weakness or dizziness, a sweating, a feeling hot or cold chills, along with any tingling or numbness of the hands. This can happen anywhere at any time for no reason or no foreseeable trigger. This is the difficult thing about panic disorder, is that there's no definitive way of pinpointing what caused it, but there is a few ways that you can take care of it and treat it. Of course, is all through CBT, cognitive behavioral therapy, and with psychotherapy. Depending on the severity of it, you may also be on medications for this as well, or may at least be recommended for them. It's okay, it's entirely your choice. Now, when it comes to most people, it's said that a lot of this can start when they're under a lot of stress or pressure. It's also said that this can be a trigger from being in young adulthood, and that it's also been studied that it affects women more so than men. I'm not exactly sure the reasons behind that, neither are the scientists, but that is what has been discovered so far on my account. Now, for panic disorder, there is a lot of different techniques which you can try and cope with it. As I mentioned before, the cognitive behavioral therapy and the psychotherapy will be very helpful. There is also, you can do art music therapy, deep meditation, and the psychotherapy, the goal is to find a way that you can correct your mentality before you put yourself into a direct form of panic. So a way of recognizing when you're starting to have those sensations and acknowledging how you can go about stopping them. That's actually the critical point in these videos that I would like to help you illustrate. So whenever you start to feel this way, just try to assess your situation and pinpoint what it is that you are feeling panicked about. If you cannot see it or understand it, you can always try the grounding technique, which will help you kind of hone in on your senses and realize that you can clear your mind. And once you do so, you can go ahead and then from there, with a clear state of mind, try to pinpoint what it was that caused you to feel that way. But afterwards, you can just go ahead and continue these practices. It's not something that will be, cured overnight. It takes a lot of conscious energy and thought, and sometimes it can get a little exhausting. So be sure you are taking easy care on yourself, and that you're not taking it so personally for when you have a bad day or a bad situation where you just kind of need to, withdraw a little bit. It's very typical for people who have panic disorder to avoid areas in which they've had a lot of panic attacks or episode, and so this can actually take them to a degree, depending on some cases, where they won't even leave their house. And so this is something that is to help bring awareness to that, and by all means you can research further into panic disorder to see if you can get some more definitive answers and see if you can get a little bit more understanding along with it too. The majority behind these posts, every time I do one, I always research it beforehand, so I know that I'm giving you guys the best information possible. So be sure that you do the same thing. Research what I'm saying, research what anybody is saying, because you never know what's true on the internet these days. So just feel free to continue following Real Talk with Cece. Be sure to like, comment, and share all of these post videos, and just keep updated on the conversations that we're going to be having. After this, we are going to be talking about OCD and then PTSD as our part 4 and part 5 of our anxiety series. And then from that, we'll switch it up to a little bit of a lighter subject because we could use a little change up to make it a little more optimistic for you guys. So thank you guys for staying in and tune in, and be sure that you guys have a wonderful day. Now you